Hi everyone. Joanne's just called me and said she's going to be a couple minutes late. And yeah, she'll be right here soon.
Good afternoon, everybody. Sorry I'm a few minutes late today. Hope you're all doing well. I will kick it off with an icebreaker today. Quite a bit more snow up where I am now rather than in Leb, but curious, if you were homeschooled, then did you still have a snow day and what did you do? And or what do you remember about best part of snow days when you were a kid? Um, I remember, I don't know why we did this, but we used to take the plastic bags from bread loaves and like put them over our socks and then put them in our boots. I don't know why that was a thing in my family. And I used to have these little red, I think they were called like K-tel skis that like were this big and you strapped them onto your boots. And we had a hill behind our house. So I definitely remember getting those little skis on and just having fun and celebrating not having school that day. Hi, Julie. How are you? Fond memories of a late delay or school day?
I would say very similar. And I do remember the plastic over the socks too. It's funny. But yes, just that pure joy of no school and freedom to go outside and play in the snow.
Nice. Hello, Kimron. Nice to see you. How are you today?
I'm good. How are you all?
Welcome. Great.
Yeah, thank you. So I'm trying to think about great snow day activities. I think always trying to just build a snowman, even when the snow wasn't really conducive to it. If it wasn't sticky enough or it was like fluffy or too wet, like still just trying anyway to make a little guy. So
Great. Hello, Alexa. How are you?
I am good, friends. How's everyone doing? It's Monday again, right? It always comes around. Snow days. I used to love snow days when the piles were really, really big and we could dig out tunnels in them. And my grandfather used to throw buckets of water and freeze them. And before my mom and dad could come out and yell at us for going sledding in the middle of these hills on ice, we used to have great fun. And I grew up in an area, like many of you, where you had socks and you had boots and you had sweaters, and you also had that good old bread bag to help keep out the water with your frozen toes. So
Glad it's just not me. Hey, Sean, how are
I think
you?
it's a New Hampshire, rural New Hampshire trick. I think that several of us had, regardless of age. It's a timeless one.
So I remember when I was a kid, we used to actually have snow. And sometimes in November and usually in December. So we could do a lot more. So we went sledding every opportunity we could. All the kids in the neighborhood was a big hill, and that's what we all did. And we really enjoyed those snow days, not having to go to school. That's what I remember.
Mhm. Hi, Anna. Thanks for letting folks know I'm running a bit late. How are you today?
I'm well. It's hard to think about that right now because in White River Junction we just have slush. But I don't remember anything other than being ecstatic to shovel the driveway. And we never had anyone plow it. And my parents, well, my mom works from home and my dad sometimes works from home. So they usually didn't have to go anywhere on snow days. So it would take me all day and I would be the only one shoveling the driveway, but I would do it. And it was very fun. It wasn't like my parents were like, Anna, go shovel the driveway. It was like me being like, school's canceled. I get to shovel the driveway.
That's
If
great.
you ever need your driveway shovel.
Yeah, I'm like, whoo, extra talent there. Hi, Amy.
Hi. I grew up in Massachusetts and we did have snow and we did have Wonder bread bags, which was also our how we packed our lunch because we couldn't afford Ziploc bags if they had them. I don't know if they did. But I remember when I was I was turning 6, my father had a harebrained idea to move to Texas and open a business. So that winter of my first grade year, it snowed in El Paso, and we were the only kids like in the city that had snow clothes. So we were playing amongst the cactuses and cacti, whatever, and enjoying what other people considered like a massive disaster. We were like, what is the big deal? We have the day off. What's the big deal? So that's one of my biggest memories. That and the blizzard of '76, which was, we had massive tunnels in our yard.
Wow, those are great memories. Hi, Faye.
I also a member of the bread bag club, which I remember keeping you away from the very wet felt liners because you wanted to go out before they could dry. But I also remember the only time I probably paid attention to the weather when I was really young was on Sundays if we had company, because we had moved up when I was young from Connecticut, and friends would come up and ski, and we would watch. And if we thought there was any chance of snow, we would engage in snow dances, which were very loud and energetic, hoping to get enough snow that they couldn't go until the next day, and we'd get a snow day. So that was one.
I can picture that. Great. We haven't seen each other in a bit, so thank you for joining the meeting today. Quite a lot to talk about, and we're going to kick it off with Amy. Some updates from the ECEA, the work that you've been doing.
Hi, sure. Well, I'm hearing that our congressionally directed spending request is still there, and just trying to get a timeline on that. I'm told it could be the fall. So that would delay some of our work. So we're trying to get some more information around that, about when we could encumber expenses and things like that. Family childcare, our family childcare work, we're still having people pop up interested in becoming licensed or regulated care, and they are the leadership team is deep into their strategic plan. I do not attend those. We don't like to have too many. We'd outnumber them if our staff attended the meetings. And so then the group seems to be building momentum, which is pretty exciting. We have engaged in our center-based work. We engaged a center that had never reached out before, and through licensing and some needs that they needed for training, they were referred to us. Again, licensing has been an adversary, like just really helping us make connections and legitimize our work. So I mean, it's pretty much status quo. We don't have a group in our in training right now. So we're doing kind of like setting back and trying to build a written plan of our work and kind of document everything that's gone over this whirlwind of a year. And yeah, oh yeah, we were contacted by Public Consulting Group who got the RFP for the workforce training in the state of New Hampshire. And they are interested in piloting and moving some of our work forward statewide. So we'll stay tuned. I don't know what that's going to require yet staffing wise. So we'll see what we can do. But that was pretty exciting to have them reach out.
Yeah, that's huge. I'm wondering, with the meeting coming up with Dartmouth Health and Dartmouth College on the 21st of December, is that something that we need to rethink requesting of funds if the congressional funds don't come through from the fall, or was that already considered in advance?
Well, my understanding is that they're looking good. Like, it's promising. It's not, there have been people that have dropped off, I've heard of. The problem is that you can only use those funds on one-time expenses, and that's really the startup. And so we can't start up until we have permission to use the expense to incur expenses. So I don't know if that's after official award. That's what we're trying to find out. If we find out that we've been awarded, but the money doesn't come through 5 months. Julie, do you know anything about that?
Yeah, I think it would depend on how they define, encumbered from that source of funds. I'm not sure.
Yeah.
And I mean, we're looking at solid summer, fall.
Mhm.
I thought January, February, but I think Madison was just playing with me, toying with me. But yeah,
Okay,
so
well, I
if
mean,
it
that's
were,
nice.
Other expenses, we could get going, but we can't. So
Right.
that's what's holding us up.
Yeah, it's a lot of great things going on. Sean, how are you doing? What step are you on with the funding seeking for the Early Learning Center of the Upper Valley?
Basically, so far, people are looking to see, they don't want to be the first one in, so they're looking to see what others are going to contribute. So that's kind of the spot we're on right now. We've got 3 other appointments we've got scheduled coming up. So we're moving along as planned, but everybody's kind of saying, well, what's your baseline amount that you have coming in and who's on first, that kind of thing. That's what everybody's kind of waiting to see.
And you can't just say, hey, we're starting with 5 million apiece. Would you like to join? Yeah.
We did, and the responses we got were, well, let's see how the rest of your donations come in.
Okay.
So they're being a little bit guarded about that, you know, asking how many slots they can get, you know, the amount of money they got to contribute kind of thing. So we got to get that first one in. Once the first one comes in, the rest of them tend to fall. That's Christine was talking about that. That's the pattern he's used to. So
Okay, great work on that.
Sean,
Damien's
just
not here.
curious. Oh, sorry.
Go ahead, Julie.
Just to follow up with Sean, have you had any banks indicate interest? I would hope.
So Mascola Bank, and he hasn't gotten back to me. I've had 2 conversations with him when we have other business that we've been dealing with. They just haven't gotten back to me on that. And Sarah was working with the corporate counsel, and that's when the banks were on there, but they have never gotten back to me.
Mhm.
So I don't know what's going on with that one.
Well, good. Hopefully Mascoma would be supportive, I would hope.
Has anybody heard any updates from the Orange County Center? If their funding came through, they were heading in a good direction. I haven't heard anything else. So, okay, I can check in. So Anna and Cameron have been working on food resources. This came out of a concept from a retreat at the ECEA, and then a survey was created, and they've been analyzing the results. And as with everything, it's just not a one fix kind of thing. So would you mind giving us an update?
Yeah, thanks. So we right now have an option. Actually, let me pull it up. We have a diagram of options for pilot programs that we pulled out of the survey and from individual conversations with providers. As Joanne said, it's not a one fix thing. So right now we are going to work with a couple of consultants that Vital Communities works with. Really just they're good at sitting people down with projects and fishing out what they're trying to get and what the best methods for doing that are. Because our next step, we'd like to hold focus groups of providers, and we would have ideally one focus group would be one option for what the pilot program could be. So then we can get more details on what providers would need from that one pilot program. Problem is, how do we figure out which of those pilots are most needed, and balancing that with the greatest impact on the community as a whole, and also what Vital Communities can actually do. And that's why we're pulling the consultants in. And Pam, do you have anything else to add while I pull up the diagram? Or maybe just, Cam, a little bit about your background so that everyone can meet one of the faces behind this project.
Yeah, sure. So I was brought on to Vital Communities last August to be the regional manager for the Upper Valley branch of the Vermont Everyone Eats program. I came from working at a food hub for the past couple of years, so I did a lot of working with local farmers to aggregate and distribute their products, did a lot of consumer education about local food and food systems, and also did a lot of our initial work on food security initiatives there. And so I've been really excited getting to work with Anna and getting to learn more about kind of the landscape of ECE in the Upper Valley and figuring out how we can integrate some of the work and the relationships we have in the food systems world into ECE work to try to alleviate at least one of the pressure points that different providers and families are feeling. So.
All right, here is, can everyone see that? Is it too small to see?
That's good right there. That works.
Okay, awesome. Okay, so out of the survey and individual conversations we had with providers, we came out with 3 main buckets of areas that are not working for providers, or of what they need. So we got delivered food, infrastructure, and then CACFP. So delivered food, there are many providers I talked to that have recently discovered organizations or businesses that will deliver groceries to them so that they don't have to drive an hour if they're going an hour to get groceries. Or they just don't have to worry about standing in line at the grocery store. That was a major stressor for some people. It's like one provider said that even just standing in line to check out with groceries was a huge stressor for them. So, based off of all the surveys and individual conversations, I tallied how often something was brought up. So, having delivered meals, whether that be pre-portioned or family style in bulk, those 15 providers said that that would be helpful for them. 16 providers said delivered fresh local produce would be helpful. 9 said food to send home with families. Delivered local dairy products was only mentioned once, but we also had a question on the survey of what age group do you serve and how many of those do you serve? And there were, I haven't tallied it yet, but there are a lot of the age group who need milk. So we know that most providers need dairy.
Internet's a little wonky today.
Yeah, I was gonna say, I know earlier Anna was having some connection issues, and then a couple other people, I think, over in White River too, so.
We got a lot of heavy, wet snow, and it's still snowing. I didn't think it would work this well.
Yeah, definitely.
I'm sorry, I got frozen. I was listening to the end about one person needing potentially milk, and then I lost it. So if you could just repeat the end.
Welcome back, Anna.
Sorry about that. My internet
Oh, a whole
has
bunch
been...
of us got bounced off. Okay.
Yeah, it
probably.
was not just you.
Okay.
I heard up
Sorry.
until one person needing milk, potentially.
Yes. Okay. Yeah, so basically if delivered food would take a lot of the stress of time and having staff to prepare food and going to get food, will it increase stress of infrastructure? And so infrastructure is refrigerators, freezers, counter space, bottle warmers, microwaves, dry storage, any kitchen facility or storage that you might need to run a food program. So one of the questions we asked was, do you feel like you have enough refrigerators, freezers, microwaves, etc., to run a meal program? And 20 people said that they don't have enough of that. And then 9 people said that they don't have enough counter space. So these were 2 options that we came up with based off of those needs. One is significantly easier than the other one. Vital Communities secures funding and then passes it through. Either we buy them refrigerators or we give them money to buy refrigerators. It'd probably be easier for them if we bought them refrigerators and had them delivered and all set up. And we actually are finding that home-based providers are better equipped to handle an extra freezer or refrigerator because they have a whole house. They don't have just the original building that might have been built just for whatever infrastructure they currently have. So the contractor hiring would definitely be more complicated, more expensive, but it's still an option and it's still a need. And then another branch from the delivered food is that how does that interact with CACFP? Does if we were to purchase meals for them or give them money to purchase meals, can they get reimbursed for those? And then if they can't get reimbursed for those and it causes them to drop out of using CACFP, that might be a bad thing, because then if there are fewer people using CACFP, maybe the government will say, all right, few less people need this, so we're not going to fund it as much, which is not what we want. We want those reimbursements to increase. So CACFP, we found that the two main themes were that the annual reviews were crazy and a lot of stress, took a whole week to prepare for. They don't know how to do a lot of it, that trainings weren't offered as much as they're needed, that just the general recording of meals wasn't easy for them, and it was hard to ask questions because the people at the state level of CACFP are also understaffed. And then that the reimbursements were too low. And in talking with our partners from Vermont, Hunger Free Vermont and Shelburne Farms have both said that there is a possibility of advocating for the state to match CACFP reimbursement. So that's one option. Another option would be to hire technical assistants for ECE providers to navigate the CACFP. So that would be like a sponsor, like the Children's Center of the Upper Valley, right in Lebanon, has a sponsor that helps them navigate it. But then that complicates, does CACFP reimburse that staff member's salary? Is it Vital Communities that's hiring another person to go and do it? So we have a lot to work through. Yeah. Any questions?
Cameron asked if there's like, what's our general knowledge of the process involved? I know minimal, and I don't know the difference. If it's federally funded, often Vermont does one thing and New Hampshire does another. So are the two states different, or do they use the same formats and expectations?
That I don't know.
Okay.
CACFP is federally funded, but then there is someone in each state at that level that's handling just that state. That's as much as I know. I know that there's one person in Vermont, and I mean in New Hampshire, and there was one person in Vermont doing it until recently they hired someone else. But I mean, it's not just that one person in New Hampshire is doing all of the CACFP higher level work for every single program that is involved in CACFP, childcare or adult care. So that's a lot.
Then it makes me think about later tonight, a few of us are meeting to talk about Upper Valley needs. And it seems as though this resource person, for lack of a better word, who could support Vermont and New Hampshire, like have an understanding of both to help. And this is both center-based and family-based, because you mentioned how family-based, they're easier to be able to do some storage things. So an advocate or resource person to assist, I'm just writing it down so I don't forget, with this work seems pretty important. It could be a barrier, right, that we're trying to figure out in the Upper Valley. And just like the ECA program started in the Upper Valley and expanded, and now, looking at it statewide, if we could potentially put some solutions together for the Upper Valley, perhaps they can help both states get a bigger picture. So at this point, can we do a little bit, or we have to hold off until there's major solutions?
I think we can do a little bit, and that's what we're looking at with the pilot program. But we really just want to make sure that the little bit that we're doing is actually helpful and not just another thing. And it's the which little bit do we start with, right?
And who are you working with to brainstorm the pilot program and thoughts about timing?
Yeah, so Keely Agan and Cynthia Green are from from Shelburne Farms and Hunger Free Vermont. They're doing pretty much the exact same project development as we are, but up in the Burlington area. So we've been meeting with them frequently to talk. They've already done, they're a little bit ahead of us, so they've done focus groups already. And they're now looking at pilot and with Vital Communities with this project. Timelines like spring of 2024, I think it was, or maybe as early as February. And that's if whatever pilot we land on is matches whatever pilot they want to run.
If there's a
And
pilot program that gets kicked off, could it be sustained by donations? Does that donations impact the whole federal funding line?
do you mean like food donations or do you mean monetary donations?
I'm thinking like Barron's appliances, which is more local than like a Home Depot. If you're buying 10 refrigerators, if you purchased from, there used to be one right, not Barron's, there used to be a place to get appliances right in Lab by the Green, but that went out, I don't know, 6-7 years ago. But I'm trying to think of what's considered more of a local based rather than a Home Depot or a Lowe's. If they were to donate some things, or I think of I know little of them, but I've heard great things about Friends of Mascoma. They do food things, just lots of amazing things to kickstart. But I totally understand that you don't want to put something in place that's going to negatively impact, and it's really smart that you're taking your time to figure out what that is rather than trying to help and then realize, oh, that's not the way that we wanted to go. So that makes a lot of sense. It's just kind of brainstorming, because no one's going to care if there's a little scratch or dent on like the side of a freezer or something like that. And sometimes those things are perfectly fine mechanically and they need to move stuff on. So it's just a thought as you're heading down that way. And February, spring sounds great, because that would be just about a year since we heard about the concept, and getting back to folks would be really helpful. Any other questions for Cameron or Anna about food resources and their study and work on it, or suggestions?
I will say we're also working with a couple of folks from UNH. And one of them she's a professor, and she has some students that are interested in this work and are going to be available for helping to put together a report. So getting a report out there to the community would be as easy as just giving them our data. And then we're meeting with them on Thursday actually to talk about that.
Great.
That's going to be another.
Yeah, that's wonderful. And UNH is known for their research, so having their backing kind of come through it alongside is meaningful. So that's wonderful. Great connections. Thank you for your work on it, and just like your snow shoveling of the driveway, persevering through it, because I know it's a lot more complicated than people think by just get the answers and provide a solution. So thank you both for that. Appreciate it.
And just a quick follow-up, I think I've offered this before, but just while we're on this topic, just to be aware that there are food resources on the ECE shared resources platform, so that if that can be any part of the pilot or solutions, then Early Learning New Hampshire would be happy to have a separate conversation about that. How to make sure providers have access to the platform.
Sounds good. Julie, I will send you a separate email about that.
Okay, great.
Thank you.
Moving on to upcoming business. So tomorrow, I've been invited to attend the childcare roundtable at the River Valley Community College Library in Claremont. It's at 10 o'clock. The agenda is, what can we do to support expanding childcare, specifically in Vermont? What are the barriers businesses, what can businesses do, how can they help? And then there are home childcare providers, early childhood career pathways, education, training, grants, and apprenticeship. And Amy, I will be on a panel with Dominic Perkins from Walpole Savings Bank and Mike Tempesta, who I've met a few times. He's the superintendent of Claremont. And I have our one pager that's been shared. I kind of bring that with me everywhere. But I wasn't clear about the specific work in Claremont. Didn't want to misrepresent anything in front of the panel. And was wondering if you could, with this group's assistance, kind of help me, what should the key focus points be that I bring up tomorrow at this roundtable? It gets interesting with schools because public schools in New Hampshire don't have a mandate to do early childhood education. And we've learned some of the downfalls of that from Vermont, talked about that at the retreat. I'm not sure if Claremont runs an early preschool program as a school. I thought I would look that up tonight. But is ECE heading that way to do a program? I know we talked about it, but I don't know if it's in the works or where it is.
That's what we're waiting for, the congressionally directed spending
Okay.
for. So I've already talked to a director at Green Mountain Children's Center. She's ready. Her staff are ready. We have a plan, and there's also a group in Springfield called, I get this, I think it's like Kids Count, but there are state reps, there are local businesses, other concerned stakeholders, and in the plan, and it's also in the BBF plan. So who would have that? Courtney Hillhouse, that the ECEA will be providing the workforce element of what the identified need is.
So the career cultivator, is that what we're referencing? And is it referencing family-based as well as center-based at this point?
It doesn't. It's workforce in general, but since the ECEA is now moving toward looking at after school and family childcare and supporting them, I think that we could probably put the two together. We already cover the Claremont area, Sullivan County, with our family childcare work. I mean, Sullivan County was our focus area because they were the desert. That was the area identified as the desert. So we really focused on building family childcare in Sullivan. So that would be taken care of by that. Plus, we're looking at the ECEA's role in, the sub pool and training workforce and that type of thing. We do have some people in our workforce program that are actually, there's one in particular that talked a lot about eventually opening her own family childcare, but wanted to be in the field for a little while to learn the ropes because she was a little afraid. She didn't know the rules and everything. So we thought that was a great way to enter the field.
So if I represent the work of the career cultivator and talk about its beginnings in Lebanon and how there's a shared vision to have that in Claremont, waiting on these congressional funds, but we're looking at a potential of something for fall 2024. Is that reasonable, or don't say that?
Well, I mean, congressionally directed spending, we might start if we can spend the money before then, but if not, we won't be training until 2025 if we don't get funds until fall.
Okay.
But you could mention that this is a bi-state effort. We're not training New Hampshire people for New Hampshire. We are training people for childcare positions in that region, both sides of the river.
Okay. Also wondering about, what was I just going to talk about? So we have the workforce, we have the career cultivator. Oh, do you know anything about their technical center? is it Sugar River? Are they looking at something like the Hartford Tech program? Do you know if they already have a health sciences, early childhood education?
I know nothing about it, but our River Valley Community College is right there, so maybe they partner with something.
And that's where it's
And
actually
we
located.
already,
That's where we're gonna hold it tomorrow. So,
so Carrie Belknap Morris is the contact we have at our VCC for the early childhood program. And we're, you know, obviously our program's not, with us, it's deliberately not, doesn't look like a college program.
mhm,
It's deliberate. We partnered with an MOU with New Hampshire Tech for the credits, but we don't want people thinking this is a college level program, because this is that population that is very, you know, they weary of you know, dedicating their time, and they think it's going to be above their learning curve. And
yeah,
they're pretty surprised that they get 6 credits for all of the practicum work that they, as well as the classroom work that they get.
yeah,
I think writing is probably the thing we run into the most. People are proficient at reading, but writing, they may struggle a little bit more.
mhm.
And yeah, so I would mention that. So the workforce career cultivator, both sides of the river, and then also our family childcare. Also, those dollars from homegrown go across the river as well.
Okay.
So we're able to help both.
And then I can talk a bit about the efforts with ECEA and Hartford Area Tech Center under the umbrella of Human Services. And those are going to be 11th and 12th graders, I think, is the focus area for that group. Anything else I should mention tomorrow? Just wanted to get feedback from everyone before I represent the group. And
I mean, like Sean, we're always looking for the dollars. We, you know, someone wants to be the first one to throw in their hat toward Claremont work, because we don't have funding toward that work other than the congressionally directed spending. We haven't secured any other dollars to go down there. Well, we have a partnership with that group in Vermont that may help with some of those funds as well, but we haven't seen any money yet.
does Dartmouth Health have a location down there, or their location is New London? They're not down there. Their employees come up here, right? That's part of the issue of childcare.
They have Alice Peck Day down there in Claremont, I think.
It's
Possibly.
Valley Regional is down there, and they're trying, I think that's in the works of becoming an affiliate or a partner, whatever our current name is.
Okay. There will be Rebecca Levi from UNH Co-op Extension Economic Development attending, as well as their city manager, director of planning and economic development, and SBDC, and then a few other people coming in as well.
It would be really nice to have the cooperation from Claremont that we've had from Sean's department for fingerprinting. It's been unbelievable. We actually had someone, a family childcare provider, that was inspected on a Friday, and she didn't have her fingerprints done and should have been closed. And we were able to get her in. I don't know if it was on Saturday or the following Monday, and she stayed open. She didn't have to close. She had her daughter cover. So like that kind of support from the city, I mean, literally has kept providers open. Family childcare providers especially cannot leave children to go get their fingerprints done during 10 and 2 on Thursdays, or unless you want 6 toddlers running around your department, because they'd have to bring them with them. So, I mean, it's every 3 years. So, and it's one of the things that actually Windsor's been great. Windsor in Vermont, to get fingerprints done on the Vermont side. We've been able to go in and just go through so quickly, and the trainees have been, it was a very positive experience. So it'd be great to partner down there.
It says the
I
city.
can talk to Brent. Oh, the police chief there. I can talk to Brent about that. And
Thank you.
Claremont, they're a little bit more resource starved than we are, but I can talk to Brent and see what he can do. I know Brent, so let me see what I can do with it. I'll get back to you on that.
It sounds like
Thank you.
that would be a big help. Thank you for the
We bring
information.
chocolate.
It always works. So some of us were on a data leadership meeting. Is it yesterday morning? Seems like so. No, it could have been yesterday morning. It must have been Friday. And I just wanted you to know that there's a leadership group in New Hampshire that's looking at kind of big data collection. There's a person who was a presenter there, and his background was in doing early childhood education surveys. He had worked with quite a few organizations with high returns. One of the things that came out of that meeting is, to do this work well, it has to be funded well. So right down to, they used to do, paper mailings and then follow up with people about the paper mailings. They actually drove to a few people's houses just to kind of incorporate the data, because without having a big response, the data isn't as meaningful. So kind of the take from that conversation was, to do survey work well, it needs to be funded well, managed well, enough people to follow up on the surveys, different ways of reaching out to people to fill out the surveys, keeping the survey one page if possible, keeping the questions pretty succinct, keeping questions where people don't have to leave their desk to go out and find the data and then come back, because between then 10 other things are going to happen to them and they're going to forget to come back to complete the survey. And the last part, pardon me, that I heard was a conversation about sharing surveys from the past, and he didn't think that he had access to them anymore. He had since moved. They were in the days of paper copies, so not sure recreating them, but there must be enough surveys around to be able to find some that have been used, that have been effective, that are short and succinct, but also that the data is meaningful. And because I was driving in my car, I don't know everybody who was on that meeting yesterday. Amy, I recognized your voice. Julia, were you on that one as well?
I was supposed to be, but I was not able to be on.
Okay. Were there others from this group who were there? Amy, did I miss anything? Did it end up with concrete steps moving forward?
And
I think
do
we
the
know
work
that
and history of Michael Kalinowski, who used to be with UNH, and he had done the market rates surveys for a number of years and did a really great job with those for all the reasons you talked about.
Okay.
And Julie, I feel like we worked with you. I can't even remember, but it's kind of a blur. It was a while ago. He talked a little bit about the true cost of care survey that we project that we tried, and the struggles and how it kind of petered out because it was so tedious.
Yeah. That's long been a goal, to get to separate from the market rate survey that's required federally for states to do. We had long wanted to get a true cost of care survey so that we have a really good handle on what it actually costs to provide the services, not what the reimbursement rates are or the fees, but the actual cost to provide care. And that's not easy to do, although there are some federal tools available. But Amy's right, that's long been a goal and would be really timely now, knowing that all the costs have increased so dramatically for programs. It would be great to try and get a handle on that.
I'm not
and
sure.
I feel like,
List.
and we know that for family childcare, it's going to be even more difficult because a lot of family childcares don't have a budget. They don't have those tools that most center-based programs have to draw from. Quarter 1, 2, and 3, what did this cost? Like, they're not going to know. So I think it's going to be a pretty big challenge. I would like to know how Vermont, where they landed with theirs.
Okay. I also wanted to mention that I did email back, get an email back from Tim Corwin from City of Lebanon in regard to the potential expansion of the modular at the center in Leb. There's quite a few things to hop through. So Amy, I plan to send you the email correspondence and attachments. And perhaps we can set up a Zoom time with Tim to walk through them so we're on the same page as to what next steps are. So I can keep everybody in the loop. Very appreciative of his email back and the information that he provided. And I think that having a Zoom with the three of us makes a lot of sense as far as what you've already accomplished. It's not a complete do-over, but in a way it is a restart. And the exemptions and things that occurred for I'll call it phase 1, don't match what needs to happen for phase 2. So we will see where we land and go from there. But I wanted you to know that that email will be coming your way. Any other business for workforce and program models? A lot of good work happening. Okay.
I just
Yeah.
wanted to flag that I sent out the honorarium and reimbursement email. So that's just for anyone who's not already being compensated by their organization for time or expenses that they've incurred during this month. So just December. And then I'll send it out again on January 1st, and then that'll be for the whole year. So it's anyone who is not already being compensated.
On a side note, Week of Young Child is not being forgotten. Anna and K2 and I are meeting Wednesday at 3:15, and I'll be bringing those ideas forward to the advocacy meeting along with the team on Friday. So we're going to keep moving ahead. April will be here before we know it. I had a question for this group. We decided to meet once a month just because everyone is doing really well and then coming back and kind of reporting with what they're doing. And the next meeting happens to fall on January 1st. Didn't know if people were going to be away. The next meeting date after that could be January 8th. I'm free on both and wanted to ask the group which date works best.
Vital Communities is still on vacation on the 1st. So the 8th would
Okay.
be better for.
Does January 8th work for people's schedules? Seeing head nods. Alexa, does that work? Yeah. All right, for the agenda, our next meeting will be January 8th. It'll be at 12:30. If there's any way that I can assist or help in any way between meetings, please reach out to Anna and I. We're happy to help. And I wish you all a wonderful holiday season. If I don't see you before then, and safe travels, and I will talk to you soon. And I guess Happy New Year. Take care.
Same to all. Bye.
Bye.